It's actually quite unique here at Duke. It's called the Global Health Pathway Program, and so it's primarily supported through the Duke Global Health Institute, or DGHI, and then co-supported by whatever department the fellow is trained in. And so I joined the fellowship program in 2020, and it's a 2-year program, so I graduated in 2022, right during the height of COVID. It's really a unique program because of that dual support between DGHI as well as the department, but along with what your abilities are throughout. It primarily is a research-based program, and so the goal is to develop you as a junior researcher, but it does have a significant clinical component. And so within that first year, you're expected to be here on campus getting a Master's of Global Health and building that research project that you'll implement. And then that second year, you're on the ground abroad and implementing that research project and actually getting to live and breathe it. So I think additional unique aspects of the program that I did not know until I was here. One is that we have a Global Health Journal Club, so we try to get together once a month, specifically the fellows who are part of the program, but any other faculty in any of the disciplines that are able to join in order to talk about different literature specific to the global health realm. Now the topic changed each month, whether it be HIV, cervical cancer, ethics in global health, but that was really a unique opportunity to get together with my co-fellows as well as the different researchers and clinicians in the global health capacity here at Duke. So I really enjoyed that and thought that was a bit unique. And then I think having the full year abroad, well supported by the DGHI as well as the department, and then through my Fogarty Fellowship, is really unique in this, is the fact that you get to be there for the full year to completely implement and analyze your project. The research experience really starts even before you come as a fellow. So once I matched as a fellow, I was connected with Dr. Hutchko months before July 1 when I officially came to Duke, and at that point we started brainstorming ideas of what I had in mind as well as some projects that she was considering. And so our specific research was on cervical cancer and HPV, more specific stigma and people's perceptions of getting cervical cancer screening and the HPV virus. So that was really unique, and during that first year she served as my primary mentor, but then the faculty that are part of DGHI really helped kind of guide my thought process and helped build my analysis plan in different capacities. And then during that second year, so the full year in Kenya, I had most of the process in place, and so that way when I hit the ground I was able to start implementing the project. So I actually lived and breathed the project for every day, going to the different clinic sites, participating in the care, and then the analysis and manuscript writing afterwards. Each day really brought kind of a new adventure, and so that was really exciting for me. And then I also really got to see myself grow personally and professionally in ways that I really hadn't anticipated. I'd spent some time abroad before, but not in this length of capacity, and so it really developed me in my professional and personal abilities and career. Taught me to be more flexible, a lot more patient, and then really have more empathy for my patients and my coworkers. So I was really able to land a fantastic job that combines both my international passion as well as living in the US and practicing as a generalist. And so it's a unique opportunity that I have. It doesn't really occur very often, or there's not very many people that get to have the job that I do. So I'm really humbled by that and excited to kind of pave the way for that.